The 111th Tennessee General Assembly is underway at the state capitol in Nashville. Lawmakers are reconvening to discuss several topics like abortion, medical marijuana, and health care.
Channel 3's Caroline Corrigan spoke to Governor Bill Lee ahead of the General Assembly on how the state plans to improve its crippling health care system.
Over the next 3 to 4 months, we can expect Democrats to push for expansion of Medicaid under the Affordable Care Act. But it's unlikely the GOP-controlled legislature will support the expansion. Instead, Governor Lee says they're waiting on approval from the federal government on the state's Medicaid block grant waiver. It's no secret Tennessee is in the middle of a rural health care crisis. From hospital closures,
we need emergency health care here. We need a walk-in clinic here.
Like the 2013 closure of Copper Basin Medical Center in Polk County, which left thousands without access to health care, to the state's ongoing opioid crisis.
I believe that every Tennessean, no matter where you live, you ought to have access to quality health care that you can afford.
But how?
We proposed this year the first of its kind in this country Medicaid block grant waiver proposal to the federal government that would broadly improve our opportunities to serve our Medicaid population, for example.
The block grant would allow the state more power when deciding who is covered under TennCare and how much the state will pay for each person. TennCare provides health care to 1.4 million people, primarily low-income pregnant women, children, and people who are elderly or have a disability, with an annual budget of $12 million. Governor Lee's plan has sparked concern amongst several Tennesseans who have voiced their worries at public meetings. In October, Rosalie Howes voiced her concerns that this plan could cost her son, Hiram, coverage under the Katie Beckett waiver, which provides health care to children with disabilities. Without it, she says his medical bills would be about $2,000 a month, a price she cannot pay.
For him to get covered again, we could either divorce, we could institutionalize him, or we can move to a different state. Hiram's life depends on TennCare.
Reporting in Chattanooga, Caroline Corrigan, Channel 3 Eyewitness News.